The Department of Health is today releasing the findings of the 2021 Global Adult Tobacco Survey SA report. The report aims to determine the use and burden of tobacco in the country. South Africa has a huge burden of tobacco use, exposure to secondhand smoke. At the same time, a significant amount of money is being spent on manufactured cigarettes in a country with high levels of poverty. On this, we're now joined by video link by Professor Lekan Ayo-Yusuf, Director for Africa Center for Tobacco Industry Monitoring and the Policy Research at the School of Health Systems and Public Health at the University of Pretoria. Thank you so much for your time, Professor. Just give us a sense of what then we can expect in terms of the findings of this Global Adult Tobacco Survey report.
Thank you. Thank you for having me. The report actually has been released this morning, and a couple of things were highlighted in that report that we should take note of. As you said in your opening remarks, on average, a smoker spends 263 Rand per month. And with 10 million smokers means we have about 32 billion Rand spent on smoking. Essentially, we burn in South Africa 32 billion Rands every year on smoking. Now, if we look at how much is then spent to look after the smokers when they fall ill, it's been estimated to be another 42 billion Rands. And then the SARS only is able to collect something like 12 billion. So we do have a situation where South Africans are getting more into poverty. It's becoming more difficult for the South African government to be able to take care of this population that eventually fall ill and die, and the breadwinner of the homes are lost. Many of this money comes from grants that the government is using to alleviate poverty. So it is not just a health problem, but it's also an economic development problem that requires urgency.
What does it do and the implications of it on the health system itself, Prof?
Most certainly, particularly now that the NHI has become law. As you know, there's a specific part of the NHI that speaks to the sustainability of the NHI fund. And two of the measures specified in the Act talks to health promotion and preventing diseases. If you do not prevent diseases, it means people would end up in the hospital and they will end up taking medications for a very long time, very expensive cancer treatment, cardiovascular disease care, and NHI would not be sustainable. And therefore, it is important we promote preventive measures as is contained in the current proposed bill that was before the sixth administration, the parliament. And I'm just hoping that with the result today, the new administration would take it as urgent as a way to make sure that NHI becomes affordable and the system does not collapse by passing the bill.
And I'm interested in the secondhand smoking, of course, particularly as it impacts on children. Of course, we know that there have been reports, that were released in recent years that also spoke about children as young as 13, also being tobacco users, currently smoking, and some using the likes of vapes, etc. But just in as far as secondhand smoking is concerned, how is the picture looking like in this country?
So the issue of secondhand smoking was also quite disturbing for some of us that has been doing the studies for the last 2 decades. So we need to first of all interpret the result of the secondhand smoking within the context of COVID, because this survey happened during COVID when people were not supposed to be going out to public spaces, and therefore it was kind of obvious or very disturbing to see for the first time that people were exposed to secondhand smoking more at home than in restaurants. And that essentially is because people spend more time at home. But importantly, it means that many children will be exposed to secondhand smoke by their parents or their family members. And this is one of the reasons. In fact, it is also going to mean that even if you don't smoke and your next door neighbor smokes in a multi-unit apartment, the smoke can get into your apartment and some of the people might be the ones reporting. So 1 out of every 5 person that were surveyed, over 6,000 people, 1 out of every 5 said they were exposed to secondhand smoke. So it means we really need to do something to protect the right of those non-smokers. Non-smokers, we're looking at about 40 million South Africans. So many of them being exposed to secondhand smoke by smokers.
I mean, given that this is an industry that is a multi-billion rand worth, just in 2021 alone, as you also indicate in terms of those monies, 16.6 billion cigarettes were sold in this country, and around about, of course, the time of COVID or just before. The industry itself, how does that then become accountable for what we are seeing, whether you're talking about those that are using tobacco and those that are being exposed, from secondhand smoke?
That's a very good question. This is the unfortunate situation that we have, that the industry is not accountable. They've never taken account of all the debts and the sickness and the monies and the poverty they are creating, particularly in low and middle income countries, including South Africa. They are always in denial. They would rather feed on bribing government officials to turn the blind eye. They would rather employ all different type of tactics, including misinformation. For example, they will say they're introducing e-cigarettes in order to reduce harm from their smoking. On the other hand, they continue to market and sell cigarettes. They tell you they're protecting farmers, but at the same time, they say they are introducing e-cigarettes. E-cigarettes do not use tobacco. It means they're actually going to kill farmers. So they really are inconsistent and they lie. And that's just the truth. They give the impression that they provide economic development. As we know, most of that money that they pay comes from the smokers. So if the smokers do not spend that money, they can spend it on food. And once the industry that manufactures food is getting more sales, they can pay profit to government, and government will continue to get revenue, but instead will have a much more healthier population. So the industry has never been honest to say and take account and responsibility for what they do. But it is understandable. They're only interested in profit and their shareholders. But government must protect the population. And you can only do that through the regulations.